The views and opinions of the producers, hosts, and guests in the show do not directly reflect the official stand and policies of the management, the network, and the company. Empower your mind. Be informed dahil lamang ang may alam. Knowing the latest trends and issues in the society. Feed your mind with information that are reliable, fresh, and straight from the experts. Be involved here in the conversations with Chester Quidlat, broadcasting live in big media. This is The Conversations.
Good afternoon, Luzon, Visayas, Mindanao, and to all our kababayan worldwide. I am your anchor, Chester Quidlat, and welcome to The Conversations, your dose of informative topic and discussions straight from the experts. Okay, so I am very happy and at the same time, a little bit emotional kasi syempre, this is our last episode for this season. Ang layo na po ng ating nalakbay or nilakbay. And I am very happy and I would like to take this opportunity to thank all the people who supported me from the team of TC and to our network, Big Media Philippines, to my friends and to the schools who supported us from the past season, especially from San Beda College Alabang, together with Far Eastern University Manila. Naging suki po talaga natin ang mga magagaling na profesor dyan. And of course, to De La Salle University Manila, naging suki din po natin yan. These three universities are very supportive and every time and then when we ask support to be our guest, talaga naman pong bukas ang kanilang mga pintuan para po tayo ipaunlakan. Kaya naman po sa hapong ito, allow me to give you a more informative discussion and at the same time, gusto ko medyo nasa medium of conversation lang tayo, yung level, ika nga. Kasi I don't want this to be more of a serious ambience, but I want it to be more entertaining at the same time. Kasi alam ko na we've been through a lot from the past season. Andyan yung mga political issues that we tackled. Andyan yung mga viral things that we discussed. And ang mga pulso at opinyon ng ating mga kababayan. And for this season ender, or for this episode as we end our first season, I want to embark something unique and at the same time, talagang remarkable to all our students, to the millennials who are supporting us through this entire season. Kaya naman, again, hindi ko na papahabain pa ito kasi ang ating topic discussion this afternoon ay napaka-importante. At ito ay isa ring pagbabalik ng pasasalamat sa ating mga dakilang frontliners who have been fighting for us, no, sa pandemyang ito. Nang pumutok ang pandemya noong 2020 ng ating ito'y maramdaman at talaga namang ang buong bansa ay naapektuhan, iba't ibang industriya ang pinabaksak, if I may use that word, allow me. At ngayon, kailangan nating mas maintindihan at magbigay ng angkop na impormasyon para sa ating mga kababayan at sa ating mga manonood. Kaya naman, we all know that the COVID-19 pandemic has suddenly and deeply changed our lives in a way comparable with the most traumatic events in the history, such as World War. With millions of people infected around the globe and already thousands of deaths. There is still a great uncertainty on this actual evolution of this crisis, as well as on the possible post-crisis scenarios, which depend on a number of variables and factors. Example are the treatment, the vaccine, or some kind of immunity. Despite The optimism enforced by the positive results and recently achieved a produce of vaccine, uncertainty is probably still somehow the predominant feeling. Okay? From a more philosophical perspective, the COVID-19 drama is also a kind of stress test for our global system and probably an opportunity to consider some aspects underpinning it, right? And as well as its sustainability. Kaya naman sa hapong ito, paunlakan mo kami as we are joined by a registered technologist, residency training in internal medicine, clinical research ambassador, and medical site monitor. Ladies and gentlemen, okay, to the millennials, to our frontliners who are also watching us this afternoon, I would like to present Dr. James Tamayo.
Hi, good afternoon, Sir Chester, and all of the viewers of your show, More Power. And it's really a great honor and a pleasure to be invited in your show. And at the same time, we can share information, knowledge, and at the same time, we can break all the myth, misunderstanding for the COVID pandemic.
Okay. Thank you so much, Sir James. Meron lang yata tayong konting tech issue right now. Hindi
Mm,
po namin kayo makita. Sayang naman po.
Okay
Ayan.
po.
So, medyo
And
naka-black screen tayo. So, let's check it with
let's
our tech.
check.
So, syempre, live tayo. Kaya talagang we
Mm-mm.
experience some this uncertainty. So, let's try to check. Okay. So maybe sa end ko lang ito pero technically nakikita naman daw ang ating ang ating guest. So let me double check lang din ano. So habang tayo po ay nag-aantay with this technical concern, let's try to bring back Doc James.
Hi, yes, I'm still here. Yes.
Okay.
All right.
So Doc James, bago po nating bago tayo mag-deep
Mm-mm.
dive sa ating topic discussion this afternoon, kamusta po kayo ngayon and ano ang pinagkakaabalahan ng isang Dr. James Tamayo?
Okay. So right now, actually, we're fairly well. Like ako, I just completed my COVID vaccine, because frontliners are the one being given. But I know that the local government units of different areas are now getting list of those people who will be getting the vaccine. So, given the chance that there are local health officer who are gathering your names, your contact number, and details to be scheduled on the upcoming vaccine, give them your name. Okay? Get the vaccine. As of the moment, they always say, ay, kasi ayoko ng ganitong brand. Gusto ko ganitong brand. Okay? It can't be helped. Lalo na ngayon with the situation of COVID, it's very inevitable. We have to do something immediately. No, the only way for you to get protected is to have your antibodies made by your body. And how do you do that? You get the vaccine. Okay, the healthcare system has always been very vocal about this when people are asking what is the best vaccine. So the best vaccine is the one that is readily available on your local health unit. Okay, doesn't matter about the brand, doesn't matter regarding if you're going to wait for the branded vaccine. As long as you have it immediately, then your body can make antibodies to protect you against COVID. Okay. Right now, I'm currently working in a clinical research organization, but I'm sorry I couldn't share the more
Yes.
detailed information about this because of the privacy, but it has something also to do with COVID. So, not just in the
Mhm.
front stage, but also behind the scene, we're doing something to help the community, the people, especially helping everybody fight this pandemic on just our small scale. But then again, we're hoping that if this is done, it would have a big impact regarding the treatment and management of COVID patients.
Okay, thank you so much, Doc. Pero since na-mention nyo na po no, about this vaccine, gusto ko lang pong basagin no, yung
Mm-mm.
stigma ng mga tao na iba yung pananaw. Doc, can you give
Mm-mm.
us more informative words? Kasi may mga tao na takot magpa-vaccine kasi
Mm.
marami daw mga balita na meron daw po 'tong negative side effects.
Mm. Yeah, narinig ko nga yun. Okay. Just to address this, okay? Guys, if a vaccine was administered, nabakunahan po kayo at may naramdaman kayo na nilagnat kayo, nag-chills kayo, or parang may flu-like symptoms kayo, that's normal, okay? Kasi that is how you would know that the vaccine is working in your body. Why? Kaya ka nagpapakuna, it's because the vaccines are mimicking the causative agent. Ginagaya yung stimulation para yung katawan mo gumawa ng antibody, no? So pag may symptoms ka na nilalagnat ka, no, nagchi-chills ka, and it would actually regress naman, okay? Mga minor side effects lang to na nagpapatunay na the vaccine is actually working kasi gumagana yung katawan mo, gumagawa siya ng antibody. Anything that is administered in our body kasi are foreign to the body. So ang gagawin ng immune
Mm.
system mo, lalabanan niya ito. And these are the some of the few mechanism, physiologic mechanism, how the body reacts pag may pinasok sa katawan natin. For example, the vaccine. Okay? There are different types of vaccine. There's an active vaccine, attenuated vaccine, pero I wouldn't be touching on this because it's much more
Mhm.
complicated. But ang pinaka-gist nito, vaccine ay parang gagayahin yung nagkakos nung sakit. And it's going to be introduced to your body on a mild basis lang po para mag-react. Now, pag nag-react na yung body mo, gagawa na ng antibodies, panlaban ang katawan mo against this causing agent. So parang pag meron ka ng antibody, hindi na gano'n kataas ang chance mo na mahawa o magkaroon ng sakit. For example, we have the flu vaccine, yung pneumococcal
Mhm.
vaccine. If you have all heard of that, we have flu shots every yearly kasi yan eh, no?
Hmm.
This would help a person have a lesser risk of having the flu. But it doesn't mean, kasi pag ang thinking kasi ng tao, pag nabakunahan ako, hindi ako magkakaroon. Yun yung lagi ko
Yes.
naririnig. Pag nabakunahan ako, hindi ako magkakaroon na. No, hindi ganon. May possibility, pero sobrang liit lang. Okay? Magkakaroon ka rin possible, pero dapat doble ingat pa rin. Yan din kasi yung nagiging cause, nagiging confident tayo, nagiging relax tayo. Nabakunahan ako ng COVID vaccine. Yung iba, nagiging reluctant na, nakakalimutan na nila mag-face mask, mag-face shield. But you have to give time for the body to create antibodies. Usually 2 weeks para ma-stimulate. So it doesn't mean na
Mhm.
pag natusukan ako, katulad ko, nakumpleto ko yung vaccine kahapon. Doesn't mean
Wow.
na protected ako ngayon. Doesn't mean like that. The body would take time to make antibodies panlaban sa COVID, and it might take 2 weeks for that. So until then, kahit na may antibodies, I still have to be careful and, safety measures pa din.
Okay. Dok, may nagtanong lang sa akin dito, nag-message, bakit daw po ang vaccine ay 2 beses itinuturok at mayroong a week or 2 interval?
Okay. Yung 2 shots kasi, that's the point wherein your body is utilizing the vaccine, 'no? The reason with COVID vaccine is to stimulate nung katawan mo, ma-recognize niya mismo yung kahawig na COVID virus na in-introduce, okay? Gagawa na siya ng
Mhm.
antibody, pero why take 2 weeks, kaya yung iba 2 weeks, 'di ba, ang period nung
Yes.
kanilang break. So yun kasi ang usually minimal na days of interval for your body to create antibody. But there are exceptions, okay? Minsan kasi kahit na hindi 2 weeks, basta may window period na iba na for 12 weeks yung iba, basta bakunahan pa rin ng second shot, pasok pa din yun. It's going to boost po, no, the antibodies that would be created in response sa vaccine. No, may sinasabi na may isang COVID vaccine na one shot lang. Bakit ganon? It actually
Mhm.
depends on the component ng vaccine. Like I said, when you go into details nung vaccine kasi, which I wouldn't be touching na kasi very
Mhm.
complicated siya, may tinatawag kaming anti-attenuated vaccine. Pag sinabi mo kasing anti-attenuated vaccine, vaccine yun na ang component niya, yung virus mismo, pero pinahina. Okay? So kahit na isaksak siya sa katawan mo, pag mahina na yung virus, hindi ka na magkakaroon ng sakit. Mafa-familiarize lang ng katawan mo yung virus itself. Okay.
Okay. Thank you so much, Doc. Kasi maraming mga lumalabas din na mga So alam naman po natin how social media is powerful right now.
Yes.
Iba-iba yung paniniwala, iba-iba yung
Mm,
pino-post nila. So, for the record, once
mm,
you got your vaccine, your
mm,
2 dose na vaccine na yun, you are
mm.
not yung talagang immunity to be, hindi ka na magiging infected is nandoon. Kumbaga parang doc, parang prevention pa rin ito, no?
Yes, prevention pa din siya. It will lesser the risk, but not totally
Mhm.
clear you out. Kasi kahit na, for example, nagpa-vaccine ka nga, you completed the 2 shot, it was been more than two
Mhm.
weeks, you already have an antibody. Okay? And then exposed ka, nagpabaya ka, lumabas ka dyan sa daan, namasyal ka, wala kang face mask, may face shield, and may exposure ka ng 3 tao na you don't know, positive pala, and you inhaled the virus. So mataas ang risk nun na magkasakit ka pa rin. Okay? Isa pa sa mga documented um, journals na nabasa ko, what's unique about the antibodies being produced with COVID-19 vaccine, nakukonsume siya. So,
Mhm.
oo, nako-consume siya for quite some time. That's why isa sa reason why dino-double dose is to fortify the antibodies production, 'no? Yung mga nagkaroon ng COVID-19 na nasakit before, like for example, me, I had COVID last July, and then I
Oh.
was positive for that. And then after several months, I decided to have and to check if I had developed antibody, 'no? So a test was conducted on my own, my preference na kasi I was curious eh kung
Mhm.
magpapabakuna pa ba ako or hindi na. Kasi kung may antibody ako, bakit pa ako magpapabakuna? Yun yung tanong ko sa sarili ko. And then I
Hmm.
had this test, no, to measure the antibody for COVID. Medyo expensive lang siya ng konti.
Mhm.
Um, Meron na nag-develop ako ng antibody pero napakababa. It's only about 200 something lang. If I recall, it's around 231 lang. Very low, no? Unlike if you have a vaccine, I can boost more antibodies. My body can create more antibodies in the future.
Hmm. Kasi Doc, no, educate me because I'm not in the medical field and for the sake of our viewers din po, no. Kasi they are knowledgeable about the word antibodies. So this one came or nag-release ang katawan natin once a person got infected and then gumaling.
Yes, yes.
Okay.
Uh, it's actually not the term is released. It's more of creates. No, the immune system of a person is very complicated. That's why ma-admire mo talaga na ang galing-galing ng katawan natin. Despite having this body, our body can create and respond to different numbers of bacteria and virus. 'Di ba? For example, hepatitis. There are vaccines for hepatitis. Our body can generate and create antibodies against this infection. Okay, for pneumococcal vaccine, no, when you're given a pneumococcal vaccine, your body can create antibody specifically for pneumonia. Okay, for flu
Mm.
vaccine, when you're given flu shots, your body gumagawa siya ng para sa flu. That's very that is very ma-admire mo talaga yung katawan
Yes.
natin, no? For example, COVID, wala tayong COVID antibody, but when your body gets familiarized that this one is an invader, this one can help harm your health, it would create a protection in the form of antibody. And these are being generated
Mm.
from cells in our blood.
Okay. Doc, follow up lang. Bakit yung iba, after nila magka-COVID, since nagkakaroon na siguro sila ng antibody, nagkakaroon pa sila ulit. Nagkakaroon ng COVID. Like what happened to other in the news, no?
Yes, yes, I do understand that. My stand on that is because ang immune response ng tao bawat isa iba-iba. My
Mm.
immune response is different from yours, no? Ang kay Pedro ay iba kay Maria, iba kay Juan, iba-iba tayo. Bakit sila nagkaka-COVID despite having vaccine? I don't believe na sinasabi nila na the vaccine didn't work. I would say na there are factors to consider. When they were vaccinated ba, were they continuing the practices? Were they wearing masks when they go out? Or were they going
Mm.
outside, especially the public places, no? So exposure is one of the main problem. And I actually also did a research study on regarding with the safety precaution.
Mm.
The most basic precautionary measure to prevent this is hand washing. Okay? Kasi when
Mhm.
you do have contact or you have exposure, when you ask people about is it your practice to wash your hands before eating meal? Hindi.
Mhm.
It's one of the most neglected basic practice. Now, for the mask, nung na-vaccinan ba sila, did they continue wearing mask? Or ang daming mask outside sa market ngayon. Some of them napansin ko maninipis, if you would notice, no? Usually, if they are able to acquire or have access, get the three-ply makapal na mask
Mhm.
for your
Hmm.
protection, no? If they can have N95, much better, or a raspberry
Okay.
KN95, it's okay. Pero ordinary mask would do, but always check on the box, the label. Dapat nakalagay doon three-ply. Three-ply mask, no, lessens the risk of getting
Mhm.
COVID, and also face shield. So may mask na, may face shield pa, so the risk is much more lower.
Okay. So, Doc, maraming pumapasok na katanungan ngayon sa aming message. So,
Mm,
magbe-break muna tayo, ng short break tapos, talakayin po natin ito. Okay?
okay.
Thank you, Doc. Magbabalik pa ang The
We'll be
Conversations.
back shortly. This is The Conversations, only here on Big Media.
Let's dive deep into an all-boys conversation with Voice of the Boys, taking up full sessions about movies, anime, martial arts, and more. Voice of the Boys features pop culture, discussions on male topics, and issues with a hint of female perspective. Hosted by your resident voice artist, the Rick Matthews, and Voice the Slayer, Joshua Ravales. So grab a popcorn and enjoy the Voice of the Boys, only here on V81 Radio, Manila.
The program that gives you the latest in Filipino business and trends, with norm challenging brands, paving the way to be next generation business leaders. This is Talk Shop Asia Next Gen, connecting you to the future. Hosted by business and transformation mentor Rolly Bagaspas, franchise and business coach Don Senita, and beauty and business maven Muriel Villanueva, together with Mr. Millennial JP Morales and Agri and Youth Advocate Colin Valyaban. Jump into the business revolution. This is your Talk Shop Asia Next Gen, only here on Big Media.
Buckle up and get ready, set, and go. Join Sports Girl anchor Nicole Ganglani as she dives deep into the lives of athletes, fitness personalities, and enthusiasts from the sports industry. This is Sports Watch, only here on V81 Radio, Manila.
Now back to the conversations, only here on Big Media.
Back to the Conversations, and nagiging mainit na rin yung ating talakayan at madami na po ako nakukuhang mga personal message kasi they want to ask questions about the current situation of the Philippines now in terms of the COVID-19. So, kanina nakasama natin si Doc James, and ngayon may mga onting katanungan pa tayo sa kanya patungkol nga sa nangyayari ngayon na COVID-19. So, let's welcome back again, Doc James.
Hi, good
All
afternoon
right.
again. All right.
So, welcome back. So, Doc, just finilter ko lang yung ibang mga questions. Nakakatuwa. By the way, Doc James, our program are being used then and viewed and watched by students from what do you call this one? San Beda Alabang College, Far Eastern University, and La Salle University. So, ayun, karamihan po is mga students.
Yeah.
So, Dok, ito yung tanong ng isang student, no? Ang question niya kanina is, bakit daw yung mga kabataan is less yung kanilang infection, or bakit daw meron na sila sa katawan pero hindi daw ito lumalabas. But, pag nakahawa daw sila sa mga older ones, mas nararamdaman ng mga matatanda.
Okay. So I got the question. Okay. All right. So remember kasi when we're young, no, our body is much more active producing immune system. Okay. It's not just limited with your antibody, no, pero
Mhm.
the response against certain radicals, bacteria, virus is much more higher. Iba ang katawan ng bata, iba ang katawan ng matanda. As we get older, our body tends to become not weaker, but actually lesser of a defense against this causative agent. But at the same time, our body are become higher responsive. Okay, so pag bata, more active in producing antibody and has a high immune response but lesser responsive sila sa bacteria and virus. But pag matanda, our body has a no, uh, lower phase of conducting and producing such defense, but we are more higher in responding to this cause. So kung napapansin nyo yung mga bata po, walang gaanong reported na case. But there are some,
Mhm.
hindi lang nagpo-focus na nagkaroon ng COVID infection ng bata. There are some cases pero it just so happen na it is being clouded kasi mas marami talaga ang adults, specifically elderlies who have comorbidity, no? Pag may comorbidity, I'm saying these are patients na hypertension, diabetes, obese patient like me. So mas prone talaga. So if they are going to be vaccinated, dapat talaga silang i-priority kasi these are the ones na prone na magkaroon ng COVID infection.
Okay, Doc. Thank you. Okay, since the World Health Organization before already released
Mm,
sa press that this COVID-19 is an airborne disease or
mm,
virus, um
mm,
in the Philippine setup, this is on your own perspective and understanding lang, and we wanted
mm,
to know from you, bakit
mm,
ang Pilipinas ay hindi ganoon naging mabilis ang pagbaba? Kasi 'di ba, if we can still remember, we came na from GCQ, then we go back again to
mm,
ECQ. Is this something to do about the people? This is on your own, ano, to all our viewers, own
mm.
opinion to ni Doc. So, is this something to do about the people na talaga bang matigas na yun, o matindi na talaga ang virus na kumakalat sa atin, sa bansa natin?
Okay. My stand on that, ako I agree. Ang Pilipino by nature matitigas talaga ang ulo. Okay? They tend to be more relaxed and they tend to be more confident already when they have vaccinated. Why did I say so? Kasi that's what I noticed with some of the patients, even with those people who are asking for online consult, no? And we've been in this
Mhm.
pandemic for more than a year, and the way I see it, this could be much more longer. It might take another year, hopefully not so long. We tend, like for example, there are persons na alam na nga nila na the patient is already having a COVID symptoms, but they wouldn't
Mhm.
isolate themselves from them. They would remain to stay intact in a closed space. And despite that, when the patient is already at worst, no, napansin ko to eh, kung kailan pangit ang pasyente, doon nila dadalhin sa ospital. I don't know why this is becoming a practice, but it's very common. That's why we are very worried about this. I've been very vocal on this, and with the FB groups and COVID groups in Facebook and in my social media platform, if your patient is having symptoms at an early phase, okay, if you're doubting that this patient might be COVID suspect, lagi kong inuulit, dalhin niyo na kaagad, see a doctor, 'no?
Mhm.
Matigas din ang ulo in a way because I do understand there are FB groups for COVID, support group in the Philippines, and it's very understandable that due to financial constraints, yung mga kababayan
Yes.
natin, they would depend on the advice or what they say, that the comment being posted on the comment section of the post, and they would follow, okay? They would follow on it
Yes.
because of financial constraint. kung ako nga naman, I would put myself on their shoes na ano kayang gamot ang iinumin ko? Mag-o-online ako sa Facebook. Tapos
Mm.
titingin ako, magbabasa ako ng thread. Sinabi ni Sir Chester nag-ano siya, nag-comment siya, "Take ganitong medicine." Ako
Yes.
naman, punta ako sa Mercury Drug, bibili ako. So, it's one of the most common thing na napansin ko why,
Mm.
um, why this is happening, 'no? And at the same time, there are some na kung ano yung ginagamot sa kapitbahay nila. "Anong ininom mo?" Kasi sabi ng doktor ko ganito." Yun din yung iinumin nila. So, I think it's their way for cost cutting kasi financially constrained. But then again, I am advocating everyone, if you have a loved one, a relative, a friend, or anyone na feeling niyo po ay COVID suspect, 'no, have them see a doctor immediately. Kasi I always say, early treatment is much more better, okay? Because management
I
delayed is
agree.
treatment denied. Yeah.
Yun nga Doc 'no, since na-mention mo earlier, there are well, like what I mentioned, ang social media, sabi nga din namin in the previous episodes, mas ito na yung mga nagiging ano, in terms of political and medical, marami ng doktor-doktoran. And it's alarming that,
Mhm,
I am not saying majority, pero madami. Ang 'pag
mm,
nakikita nila na if this, person parang gumaling sa COVID because of
mm.
suob or uminom ng ganito, fina-follow. So
Yes,
for the record, it's better pa rin talaga Doc na to seek a professional, no, like a doctors to check them.
yes, I agree with that. And for the viewers, don't get me wrong, and other group who are being supportive with this pandemic, naintindihan ko po sila. Like I said, I appreciate and admire them for sharing their experiences and advices. But then again, if you reach a certain point that you are already doubting, nothing is happening, your patient is not improving, then bring them to the hospital. Now, if it's going to be financial constraint,
Mhm.
I know that there are lots of online free consult that has been established by the government to assist and help our people, but there are also government hospital that you could go and seek advice. It's much more better kasi na nakikita sila in person, no? Now, yung online consult naman, which is have been a practice recently kasi nga takot na pumunta sa hospital, takot magpunta sa mga clinic, no? There's nothing to be afraid of kasi hospitals are doing their maintenance and infectious control, safety. So, you can bring them to the hospital, you can bring them the clinic. Doc, baka naman kasi kumpulan may COVID na pasyente, mahawaan ako. No, hospitals are segregating those who are COVID suspect and clean patients. Hiwalay po yun. I think yun yung
Mhm.
isa sa mga bagay na dapat linawin natin. Kaya kung yung mga tao na takot pa rin pumunta sa hospital, don't be afraid. Hospital management are doing their job and rest assured na they are segregating. Kasi why are we doing this health declaration form? Why are being asked to provide the forms na with the symptoms, 'di ba? I don't
Yes.
think magpapapasok sila ng may fever, ng may cough. They wouldn't do that. So rest assured that they can come inside to the hospital, visit their attending physician, and have themselves seen. Mm.
Thank you, Doc. Sir, ito from another student from FEU,
All
he's
right.
asking, Doc, ano daw po ba yung nangyayari kapag, for example, iba-iba yung symptoms, okay lang ba na mag-self-medicate or diretso na daw po sa doktor or sa hospital?
Okay. So, yan. Magandang magandang tanong yan actually. Sabihin na natin ito, COVID is actually a very complicated disease. Ang alam lang natin, most commonly ng public is ubo, sipon, lagnat, but there are actually some symptoms na nangyayari. For example, there are COVID patients na nagda-diarrhea. Wala silang ubo, wala silang lagnat, pero nagda-diarrhea sila. May
Mhm.
patient na walang ubo, walang lagnat, walang sipon, but then again, wala silang panlasa. merong mga tao na wala namang pangamoy. The symptom is vary but it is connected with illness. So yung sinasabi niya na self-medicate, if it can't be helped, sabihin natin na hindi niya
Mhm.
talaga kayang pumunta sa doktor, malayo siya, then you can do the basic over-the-counter medication. So, ulitin ko kasi yung iba basic to pero mali pa rin yung pag-inom. So, others are drinking paracetamol, no? Paracetamol is an analgesic antipyretic. What does that mean? Ang paracetamol pwede sa lagnat, pwede sa pain. That's why if you would look at the yung pakete niya, analgesic, antipyretic, okay?
Mhm.
Antipyretic para sa lagnat, analgesic para sa pain. Now, if you're going to take paracetamol para sa lagnat, you take paracetamol every 4 hours. Okay? Kasi yung
Okay.
iba, sunod-sunod, every 4 hours for the paracetamol. Now, what about for those who are taking yung mga herbal medications
Yeah.
or, you know, this is quite a very sensitive point of view for me to give. Pero
Mhm.
ako kasi I do rely on evidence-based medicine. It has been one of my foundations when it comes to clinical skills because one of our consultants, Dr. Aquino, had taught us very well on this. We base on our medication from the evidence-based, yung mga published journals. We do appraise if we're in doubting. When it comes to herbal medications, there are some na approved, yung mga lagundi, because it has been approved na eh.
Mhm.
Yeah. Pero yung mga ibang naglalabasan, like yung mga shiitake mushroom, yung mga,
Yes.
yeah, you know, yung narinig mo rin yung iba na Chinese herbal drugs. I really don't have
Mhm.
any background on it, so I couldn't comment on this. Pero at the same time, I didn't saw any much detailed journals about this. Though, Linwa capsule, there was a study that was done, and it has shown promising results sa journals. You can check it out. But then again, recommendation wise, I might be 50-50 on this.
Mhm.
Tapos, with regards to ivermectin, it's a big no for
Yeah.
me. Yeah, it's a big no for me.
Oh.
Yeah. So, I just don't know how would my other colleagues agree, but I guess they would agree because ivermectin is not really a part of the management and treatment for COVID. Even last
Mhm.
year, no, hindi siya part ng regimen ng paggagamot namin. We had regimen or management and treatment for COVID patients, and we were able to survive this patient. So this management and treatments work. So for me, I would rely on that cycle rather than taking a chance and doing experiments of the outcome.
Correct. Sorry, Doc, no? And to, well, we have the disclaimer naman earlier. Because the one that you mentioned, the last, yung kanina na ivermectin, naging debate din siya even in the
Mm.
Senate and the Congress kasi 'di ba there is one representative who's pushing that for emergency purposes this can be take by those who are infected by COVID-19.
Yes, yes, I'm
So,
aware of that.
so
Um,
medyo mahirap din po Dok ano na mag-rely ka lang sa mga gano'n na walang medical ano pa po.
Established medical
Yes.
evidence talaga. So mahirap talaga siya. And let's put it this way. What if you have a loved one or a family member that you're giving that medication and then hindi nag-improve? Think about what if during those times na instead of giving that medication, would you have brought that to a doctor or a specialist to address the concern? It's quite a risk actually, and the topic
Mhm.
is quite sensitive to hand on. So, on my own perspective, I would actually stick with the guidelines being provided by the Philippine College of Physicians and the PISMID. It's a body or council that are guiding doctors in training and residency with the appropriate management and treatments for our patient.
Okay. Marami kang fans, Doc, no? Siyempre mamaya may makakasama tayo dito. Gusto ko lang batiin si Dr. Camille Umali Agustin. Makakasama natin siya later. And then we have here, I don't know if he is a doctor as well, Sir Nobio Humawid Lon and V. Aguinaldo. Ayan, binabati po niya kayo
Hi,
doon sa
hi.
live natin.
Good afternoon, everybody. Hi.
Sir, ito po, once and for all, before tayo pumasok with our special guest then later, no? Si Doc
Mm-mm.
Camille, makakasama din natin sa last part ng ating conversation.
Mm-mm.
Bakit nag evolve or bakit rapidly there are new strain of virus? Like we have this Indian virus.
Yeah,
And
yeah.
then, bakit nag evolve Doc? At ang bilis.
Mm-mm. You know, for this one, I think the virus and bacteria has a very complicated defense as well. It's all a
Mhm.
matter of survival, 'di ba? Parang kung ako, for example, ang virus sa isang tao and then na-expose siya sa isang agent or yung bacteria, agent or gamot na papatay sa kanya, automatic yun, magde-develop siya ng strain to protect himself in order to survive the
Mhm.
killing agent. So, same way for this virus, they are mutating, the strains are mutating with different factors, and at the same time, the virus itself is trying to survive. Okay? So
Mhm.
that's why actually pangit ang mga presentation ng COVID ngayon this year compared last year. If I just may share, during the early phase of COVID, napansin ko for example, yung X-ray ng mga dumadating or na-admit, hindi ganun kapangit. May mga patse-patse na puti. Pero ito recently this year, nung dumating yung bagong strains ng COVID, ang papangit na nila, toxic na talaga.
Hmm.
May classifications kasi ng COVID, is it mild, moderate, and severe? Dati ang dumadating pa sa are mga mild, pero mild, moderate na pinaka-toxic na dumadating na survive. Pero itong dumadating talaga ngayon, mga mostly severe na. Pero we are thankful na during this week or the past week, medyo napababa na natin yung mga cases with the help of the healthcare workers. Pero ito, yung mga bagay kasi na much complicated na 'pag hindi mo talaga finalo or nag-expose ka sa isang tao na hindi mo alam na positive pala, it's going to put you really at risk. And that's why sinasabi namin lagi na 'pag nagkakakwentuhan kami ng mga kakilala ko na resident, yung COVID dati hindi ganito kapangit. Parang 'pag
Mhm.
nakita mo siya, may chance. Pero parang yung mga lately na dumadating na COVID, ang papangit na nila. Talagang maghahabol ka na ma-survive talaga yung patient.
Grabe po talaga, Doc. And on a personal note, no, I am very somehow nakakalungkot kasi 'di ba, like what happened to the original place, no, where this virus came from. If we can see in the news and currently they are in the normal lives now ulit.
Yes.
So nakakalungkot kasi may mga ibang bansa na talagang they are the ano na, how do you call this, Doc? Parang sila ng
Fo
epicenter.
yes,
'Di
parang
ba
sila na
like
yung
what happened?
hotspot
Mm,
and focus, like the one is happening right now in India right
yes.
now.
It saddens me na talagang why what's going on kasi parang ako top of mind if if ayan yung nangyayari na this is the point of the virus once it is killed and clear. I believe lahat okay na pero ang nangyayari Doc James ang bawat bansa nagkakaroon ng mga version. That's very
Yeah.
alarming.
Yes. Like I said, the virus itself, they have a complicated way to make a defense
Mm.
mechanism to provide themselves in order to survive. So, it's more of an adaptation ng virus na rin sa environment ng isang bansa, and at the same time, hindi mo talaga masasabi sa panahon ngayon. The only way you could secure yourself is to always practice the safety precautionary measures.
Okay, Doc. So, medyo naging deep dive na tayo sa discussion natin. So, when we return, Doc, aantayin natin kung makakapasok din si Doktora Camille para makausap natin. And this time, it's more of kaganapan na as a doctor and kung ano yung pwedeng gusto naming malaman kasi, especially our viewers, kasi nakikita lang namin na napapagod kayo and yes, you're fighting dito sa COVID. Papasukin nyo kami ng onte sa nangyayari sa inyo. Paano nyo napagsasabay yung battle with this COVID in your personal life? Or should I say, meron pa ba kayong me time? So, more of that when the conversations return.
We'll be back shortly. This is The Conversations, only here on Big Media.
Welcome to Pride and Proud Asia, Asia's first online radio show that champions LGBT contribution and leadership in business and in our country and the region. Hosted by the Philippine LGBT Chamber of Commerce, Visibility, Representation, and Empowerment. This is Pride and Proud Asia. Happy Pride! Here now is the program for the millennials that will showcase young professionals' worth, aspirations, and successes in doing what they believe is right, progressive, and inclusive. Join them as they discover the path to self and societal fulfillment while making a difference. Hosted by empowered and cool millennial Erica Mizon, together with her fellow millennials, they will be making a difference. Only here on V81 Radio, Manila. Let's dive deep into an all-boys conversation with Voice of the Boys, taking up full sessions about movies, anime, martial arts, and more. Voice of the Boys features pop culture, discussions on male topics, and issues with a hint of female perspective. Hosted by your resident voice artist, the Rick Matthews, and Voice the Slayer, Joshua Ravales. So grab a popcorn and enjoy the Voice of the Boys, only here on V81 Radio, Manila.
For harnessing luck and success in doing business. This is Philippine Business Feng Shui at your service. Sa ikaunlad ng bayan, Feng Shui ang kailangan. Hosted by your partner in luck, Master Adric Dalumpines. Every Wednesdays at 8 p.m. See you on our next learning modules for luck in business. Only here on Big Media. Now back to the conversations, only here on Big Media.
Welcome back to the conversations. And earlier, before our first and second break, we discussed about COVID-19. And kaya naman, disclaimer lang sa lahat, no? And to inform everyone that it is better for you guys to check first to a professional doctor. So then, hindi tayo nagpapaiba-iba ng mga tinitake. And of course, for the sake and peace of mind, mas iba pa rin kapag we seek for a professional help na mag-check sa atin at hindi po basta-basta tulad ng sinabi ni Doc James Tamayo. At kaya naman sa hapong ito, let's try, if makakapasok sa atin si Dr. Camille. Pero Doc James, may mga katanungan lang po ko at this time medyo na tayo, medium na na tayo na mga katanungan para sa'yo. So, Doc James, kwentuhan mo naman kami. As a doctor right now, do you still have a balance or you can still balance pa rin? Kasi alam naman namin yung pressure right now. Ano yung pinagkaiba nito nung wala pang pandemic at ngayong nasa battle na kayo ng pandemic?
Okay. Paano ko masimulan? Okay. Yung during pandemic before it started, medyo kulang na rin talaga sa time with the family and personal life because I was resident training that time. And na-tiyempo pa na kasagsagan ng COVID, nangapa pa kami noon that time. Kasi syempre this was very new. That's why it's called Nobel. Kasi bago siya. And at that time, we were exerting effort, focusing every outsource that we can use to prevent this and manage patients who had COVID. So, ibang-iba talaga dati. Though, I can say na nagbago yung perspective ko when it comes to career path and decisions. So, it's not that hindi na ako I decided to stop now the medical or clinical aspect. It just so happened that during this pandemic, I'm more focused on research kasi it's one of the the strengths that I have. Kasi ang bawat doktor naman iba-ibang strengths and weaknesses. So it just so
Mhm.
happened na it triggered me na why don't I go to the clinical research field? I also thought na if I am a doctor, I can save lives one at a time. But in the research field kasi my perspective was I can save hundreds or thousands of lives in a one impact if the medications that I'm handling would be approved or okay. Um,
Mhm.
likewise, dati kasi before COVID, madaming pasyente, madaming nagpapa-check up. Pero this pandemic kasi, not only yung mga COVID lang, no, yung all around, konti na lang ang pumupunta sa mga hospital because natatakot nga sila. They had the stigma of having the risk of getting COVID. So, ang
Mhm.
laki ng pinagbago. Pero I might say na one of the good things na nakita ko during this pandemic, nagkaroon ng disiplina ng mga tao. And at the same time, um, there were patients na how do you say this? Nag Naging mas aware sila na yung mga emergency cases talaga ang dapat pinupunta sa emergency room. Kasi dati nung hindi pa pandemic, kahit hindi emergency, darating yan ng madaling araw eh, magpapa-check up.
Hmm.
Oo. So, I think those are the things na pinagkaiba ngayon.
Hindi na rin talaga po naging, well, lahat naman siguro Dok 'no, lahat ng industriya ngayon nung pumasok ang Covid na ito talaga pong nabago. Pero kayo sa medical field, naramdaman niyo na po na magiging malaking laban ito?
Yes, nagiging ano siya, naging flag talaga siya that we have to brace ourselves, we have to be prepared. During the early phase kasi you don't know what's going to happen. And during that time, marami ang hindi rin nagsasabi ng symptoms, hindi nagsasabi ng totoo.
Mm,
Siyempre dahil takot sila na malabelan, takot silang babansagan na COVID. So we do understand. Pero I would request and encourage everybody kung may nararamdaman kayo, tapos parang kahit papaano may idea ka sa COVID, tell them to your doctor. Huwag niyong itago na naglagnat kayo, na nag-uubo kayo, kasi may mga gano'n, eh, hindi nila sinasabi yung totoong nangyari. It would
mm,
affect the management, the treatment, the diagnosis, and not only that, you're going to put everybody at risk. So, huwag kayong matakot kung nilalagnat kayo, nawalan kayo ng panlasa, inuubo kayo, tapos may exposure kayo, tell them, inform them sa triage pa lang. So, you would be addressed and guided accordingly.
totoo naman.
Mm,
Doc, ito wala pa yata si Doc Camille kasi very busy siya.
busy,
We
yeah.
want to ask you, what is your message to your co-frontliner soldiers and to the future doctors and medical people? Kasi syempre ngayon po no, marami nang nakakakita lalo ng mga kabataan na you as a doctors and nurses, lahat ng nasa medical fields ngayon,
Mhm,
naging tough yung battle ninyo. What is
mhm.
your takeaway for them?
Actually, for my fellow frontliners and health workers, it's a very superb job for everybody. I know that we have sacrificed a lot, though you feel na we are not much appreciated, or you feel that we are overworked. But then again, our oath, our calling to serve, do no harm, and take care of patient has still been our priority. And I salute everyone. So keep holding on. I know right now it's very tough because the cases are upsurging again, and most of us are
Mhm,
tired. But then again, if you were tired, you feel that you're burnt out, rest, but don't quit. Okay, for those who are wanting to be doctors and are currently in med school, continue your goal, finish your med school, take the board exam, and help us fight this pandemic. Nowadays, we need more doctors. No, the ratio of Filipino patients to one doctor is very high. Hindi kakayanin lang ng numbers ng present na doctors ngayon. We need more doctors. We need more nurses. We need more allied healthcare um, warriors to fight this pandemic.
Thank you so much, Doc Jess. Nagiging emotional ako habang sinasabi mo yun. Kasi
Mm.
nararamdaman ko po from directly, since I'm talking to you, yung naging hirap na ninyo bilang aming mga bayani sa panahong ito. Kaya, Doc James, sa hapong na kasalo ka namin, maraming salamat po. And sa bumubuo ng aming network, Big Media Philippines, and the conversations, we salute you and we thank you na nandiyan kayo to fight and to be with us in this time of talaga namang we really need a medical frontliners like you. So we will not take too much of your time. I know you're very busy. And to Doktora Camille Umali Agustin, hello ate and thank you for allowing us to share this video. I know you're very busy and mabuhay po kayo lahat sa medical field. So any last words? May mga gusto kang batiin, Doc, mo ang dami mong fans?
I just want to say hi and hello to all the viewers, especially from students from San Beda, because I'm a San Beda graduate din po.
Oh,
Yeah, I'm a bed and doctor. So, hi, thank you very much. And everyone keep safe, no? Not because you were vaccinated, you have to be relaxed, you have to be more confident. Always remember to have the safety precautionary measure that is being advised, okay? And keep safe during this pandemic. And when in doubt, no, if you want to do self-medication, I would suggest everybody to always put it in mind if it's getting worse, seek a professional doctor immediately to guide you. That's all, sir.
thank you so much again, Doc. Talagang saludo po kami and maraming salamat po. Okay. So, thank you,
Thank
Doc
you.
James, and see you soon.
See you
Bye-bye
soon.
po.
Bye-bye po. Thank you, everyone.
Thank you. Okay, guys. So, it's been a very informative and talagang juicy discussion with our guest. And unfortunately, we're not be able to be joining by Dr. Camille, who's a very good doctor and a friend of mine, my ate. Kaya tawag ko sa kanya sa ate. So, she's the one help me para makasama po natin ngayong hapong ito si Dr. James. And of course, to Agustin family, to my former boss, Director Robert Agustin from DepEd Central Office, and to my lovely and super cheerful and supportive former teacher and my tita, of course, Miss Mendy Agustin. Thank you so much po. And I really miss you and I hope to see you soon. Okay. So to wrap up everything and to sum up everything then. Wow, parang paano lang pareho lang din. Well, I got very emotional earlier. That's true, no? And why? Because I feel how our frontliners fought this battle. I know that there are many lives that sacrificed and ang hirap 'no, sorry napapatulala talaga ako kasi, the conversations been through a lot of episodes regarding with COVID-19. Mapapolitikal, psychological, and now we are now very fortunate because we are with, a professional doctor who is a true frontliners and from his words, we know and then we also understand how this battle for more than a year now is going on. And sa pagtatapos ng ating programa sa ngayong season ito, allow me to share this moment with you and to thank everyone that who supported us for a long time, no? Talaga namang it's not easy for everyone, especially here in the Philippines na marami tayong pinagdaanan. Kaya siguro paulit-ulit kong sinasabi to sa aking programa para po sa lahat. Huwag na po tayong magtanim ng galit or kung ano man po yung mga masasamang bagay na nasa ating dibdib or mga nangyayari ngayon. Let's be more of positivity. Let's be more of a blessing to everyone. Dahil ang buhay po ay napakaikli at ang pandemyang ito po ay nagsalarawan at nagpakita sa atin na wala nang espasyo ang mga negatibong bagay. Lahat po tayo, frontliners, again and again, to the doctors, nurses, medtech, everyone who are in the medical fields, lahat po kayo na nagtatrabaho sa mga ospital, mapa sa ating mga magagaling at napakasipag na utility guard, salamat po. Dahil sa inyo, napadali ang trabaho ng ating mga doktor at dahil sa inyo rin po ay napabilis ang mga dapat po na maging laban sa ating mga local government officials, from the mayors, councilors, and to the barangay level. We thank you for being with us through this time. Maraming salamat po. Mula sa bumubuo ng The Conversations at ng aming network here in the Big Media Philippines, headed by Mr. Charlie Fong, we thank you. And we all wait for the upcoming season, and that is more bigger, better, best of the best for season 2. At muli, maraming salamat mula sa aking puso. The Conversations is not the Conversations without you. Students from San Beda College, Alabang, Far Eastern University, Manila, De La Salle University, Manila, at sa lahat ng kabataang tumutok, sumabaybay, sumuporta at nagmahal sa aming programa. Maraming salamat po. Muli, ako ang inyong anchor, ang inyong host. This is Chester Quidlat, and we thank you here in the Conversations.
It's time to feed your mind. It's time to know the real answer. It's time to be aware. Information that you need to know, straight from the experts. Timely, reliable, and relevant. Different sides of issues and from different walks of life. All of them with questions that demand answers. Here in the Conversations with Chester Quidlat, every Sunday at 10 a.m. Only here in Big Media.